Hi everyone, welcome back to my YouTube channel. Today we are going to talk about osteopetrosis. We will start our topic with introduction. Osteopetrosis is a rare genetic disorder where bone becomes unusually dense and brittle due to impaired bone resorption. Under normal condition, bone is continuously remodeled through the balanced activity of two types of cells. The first one are osteoblasts that build bone, and the second one are osteoclasts that break down and resorb bone. But in case of osteopetrosis, osteoclasts fail to function properly due to genetic mutation, leading to excessive bone growth, abnormal structure, and reduced bone marrow space. Talking about causes of osteopetrosis, the root cause of osteopetrosis lies in the mutation that affect osteoclast function. These mutations disrupt the signaling pathway or enzymes needed for bone resorption. Specifically, mutation in genes like CLCN7 or TCIRG1 and other are implicated. The condition is inherited in different patterns. The first pattern in which this condition is inherited is autosomal dominant, that is seen in milder form of osteopetrosis, autosomal dominant osteopetrosis or ADO. Then we have another pattern of this disease, that is autosomal recessive. It is responsible for severe form, including autosomal recessive osteopetrosis, which manifests early in ages. Then we have another pattern for osteopetrosis, that is X-linked inheritance. That is rare cases involve specific gene mutations that are linked to X chromosome. Now we will talk about types of osteopetrosis. The severity and presentation of osteopetrosis vary depending on the type. The first type is autosomal dominant osteopetrosis, that is also known as adult onset osteopetrosis. It is mildest form and often discovered incidentally on X-rays. Symptoms may include frequent fracture, mild bone pain, and dental issues. Next type of osteopetrosis we have is autosomal recessive osteopetrosis. It is also known as malignant infantile osteopetrosis. It is severe and life-threatening, typically diagnosed in infancy or early childhood. Symptoms include failure to thrive, fractures, anemia, growth delays, and cranial nerve compression, causing blindness, deafness, or facial paralysis. Then we have another type of osteopetrosis, that is intermediate autosomal osteopetrosis. It is less severe than autosomal recessive osteopetrosis, but more severe than autosomal dominant osteopetrosis. The onset is during childhood with symptoms like fractures and growth abnormalities. Next type of osteopetrosis we have is osteopetrosis with renal tubular acidosis. This form includes features of bone abnormalities combined with metabolic complications due to defective acid regulations in kidney. Now we will talk about clinical features and symptoms of osteopetrosis. Talking about clinical features and symptoms of osteopetrosis, osteopetrosis affects multiple body systems. Some hallmark features include bone-related symptoms that are dense sclerotic bones that appear abnormally bright on X-rays, brittle bones that break easily despite their density, and deformities including bowing of long bones. Then we have bone marrow compression and their symptoms. That is, narrowing of bone marrow spaces lead to pancytopenia, that is reduced blood cell production, and as a result it causes anemia, thrombocytopenia, and increased risk of infection, or that is leukopenia. Then we have neurological symptoms associated with it, that is compression of cranial nerves due to thickened skull bone resulting in vision loss, hearing loss, and facial paralysis. Then we have dental problems associated with osteopetrosis, that are delayed tooth eruption and dental caries, and also increased risk of tooth fracture. Then we have hepatosplenomegaly associated with osteopetrosis, that is basically enlargement of liver and spleen, as these organs compensate for reduced bone marrow function by extramedullary hematopoiesis. Then we have also other features associated with osteopetrosis, that are short stature and growth abnormalities, and increased susceptibility to infections, and also delayed healing of fracture. Now we will talk about diagnosis of osteopetrosis. The diagnosis of osteopetrosis relies on imaging studies. In imaging study, we do X-rays that reveals dense sclerotic bone with characteristic pattern like bone-in-bone appearance. Then we can also do genetic testing for osteopetrosis that to identify specific gene mutation associated with osteopetrosis. Then we can also do laboratory tests that blood test shows anemia, low calcium and elevated markers of bone turnover. Then we can also do clinical examination, that is evaluation of symptoms such as fractures, cranial nerve deficits and growth abnormalities. Now we will talk about management and treatment of osteopetrosis. There is no universal cure for osteopetrosis, but treatment aims to manage symptoms and prevent complications. Like we can do bone marrow transplant. This is only curative therapy, particularly effective in severe cases. It replaces defective osteoclasts with healthy donor cells. And then we can also give medication like interferon gamma 1b that stimulates the immune system and promotes osteoclast activity. And we can also give a calcitrol, that is active vitamin D, that helps stimulates bone resorption. Then we can also give sportive therapy, that is physical therapy and orthopedic care to manage fractures and mobility issues. Then we can also give nutrition supplements, especially calcium and vitamin D. Further talking about management and treatment, we can also go for surgical interventions that are corrective surgeries for bone deformities and compression surgeries for cranial nerve involvement. And we can also go for management of complications by doing blood transfusion to address anemia and antibiotics to treat recurrent infections. Now we will talk about prognosis. The prognosis for osteopetrosis depends on the type. The ADO type typically good with individual leading relatively normal life. Then we have autosomal recessive osteopetrosis that is poor without treatment, and it significantly improves quality of life, that is bone marrow transplant. Early diagnosis and appropriate interventions are critical for reducing complications and improving outcomes. So this was all about osteopetrosis. Thank you so much for watching. If you like our video, don't forget to like, share, subscribe and comment.